Hello and welcome to the GPPW Podcast, episode 4. This episode is an interview I conducted with Michele Battle-Fisher. She is an author and scientist in the US, and she has written a book about the combination of systems theory and health policy in the US. And yeah, she's a very interesting person, has a lot of different backgrounds, plural. She has training from social sciences to natural sciences to actual clinical experience. And yes, this was a very great interview, great conversation we had. Yeah, we hope you enjoyed this episode and talk to you next time. Bye. So thanks, Michele, for talking to us.
Oh, no, thank you for having me. Well, hello again. My name is Michele Battle-Fisher, and I do hail from the United States. And my background is in public health. I have been educated and worked professionally in public health for, I would say, at least 15 years. So I have a very strong interest, and I've always had a very strong interest in the health of the collective and how individual health outcomes can also affect communities and cities and nations. And one day I had the idea of trying to write a book, and then we'll be talking about that later. But I'm really pleased and excited to be able to share that with your listeners today.
You have basically the best of both worlds. You have actually all worlds. You have the social sciences background, you have worked in a clinical environment, and you have as well experiences in natural sciences and engineering, which is probably unique in the field of policy.
I will admit, coming to this realization that this is the way that I think was not easy to do. Because in the academic world, and it would also include public health, there still is a rather reductionist approach to the way they think about the world, and reductionist meaning a linear approach. Because we try to simplify what is complex about the world. But I found that I'm not afraid of the messiness. I thought that there was a place in public health and population medicine for researchers or thinkers to just stay in that messiness, that complexity. And that's where my work falls. That's where my questioning comes. And the messiness of being a philosopher, the messiness of being a person who loves law and literature is that we grapple and we struggle with questions. That is a part of what we love. And I wanted to bring that love of that struggle, intellectual struggle, over to how I looked at population health and population medicine.
Well, yes, that's very interesting. And I think a lot of us here at JPPW have a background in public policy. So we're also by default more on the interdisciplinary side of things. And I think we have quite a bit in common, especially looking at the problem first and finding the methodology in the second step.
Yes, I would agree.
And well, as your book covers both systems theory and public health, let's maybe start with systems theory.
I'd like to start off by explaining, perhaps I should clarify that system service or health systems, I think, is a section of public health that is perhaps more comfortable with thinking about complexity, though it tends to fall in the realm of policy analysis. And I would like to start off by saying that that is not the intention of my book. And also my intention is not to create data scientists, because I consider myself to be a systems theorist or systems thinker. So there are those of us who look at the world and we see how all of these different elements fit together, or we are struggling to see how they fit together. And what's so fascinating about policy, and Moritz, I'm sure this is what fascinated you about policy, is that by nature, policy is out there to try to foster an environment, particularly if I'm talking about health, foster an environment through governance and through rules and laws to help to create an environment where hopefully people would be more able to make more healthy choices, that they may be able to live better lives and have longer longevity. Another fascinating thing about policy is there are a lot of policies out there. Some are good, some have been successful, probably far more have been less than successful. But the society that's being targeted by the policies, very, very few of those policies are people aware that they're even there, that they're even working behind the scenes. We are just hopefully gaining the ability to live a life where the policy is helping us. We are probably not able to write a laundry list and say, on this particular day of my life, this policy is affecting me, this policy is affecting my neighborhood. But I think policy is supposed to kind of just be that overseer that isn't necessarily something that they're thinking on a daily basis, but it's always there with the hope that individuals will be able to live as a society, live as citizens to the best of their ability. So there is some discussion about what is health policy, and we tend to go to the World Health Organization definition of that. And so what's really important about policy, and all of your policy aficionados would agree, is that it involves planning, systems, and action, the three things in policy: decisions, plans, and actions. But what I did find in that definition is that I thought that there wasn't enough of the discussion of the system. And a system is essentially this. If you think of a system, it is the interworking of different components that make a whole. All of us suffered through physics. Did you suffer through physics?
Yeah, painful memories.
Physics is wonderful. It's a wonderful analogy because it allowed our minds to think that it isn't A, then B, then C. It is A working with B, then C is affecting A, and it's a machine. And so we're far more comfortable when we're talking about machines and how components work. But people are systems. We are in networks. We are working with and against each other. There is that pull and that release of energies between people. And so I was thinking, and hopefully you'll agree, that in policy, we develop policies, but once the policy is made, the environment in which that policy has to exist will continue to morph because individuals and institutions will be affected by that policy in different ways. Individuals have the ability and agency to make decisions to comply with that policy or not comply with that policy. So what I love about policy is that it is a system. It's like we have point A where the policy comes into effect. We have the governance bodies that are in charge of hopefully maintaining the sanctity of that policy, making sure that that policy runs as it should. But once it's out there, then people have to live. They have to exist. They make decisions. Some people are going to be helped by the policy, and there are going to be some segments of the population that's going to be less going to be helped in a less beneficial way. And so what I really love about using a systems approach, it is not what the policy is doing right now. It's continuing to look at how that policy is living with people who are living and existing under those strictures.
In general, I couldn't agree more with what you just said, but I would maybe personally add that policy as such and as a process is always just an attempt. It is by definition imperfect. It's always an attempt to make things better, an attempt to enable people just a bit more. And going back to maybe someone like Jeremy Bentham, it's always the attempt to create the least pain for the most people.
So yes, yeah. That's a perfect way of putting it. But I also think, particularly because within the public square and the public sphere that, let's take, for instance, the United States. The United States and our U.S. health policy system. The U.S. has the most expensive healthcare system in the world of developed countries. However, if we compare the benefits or the results of that policy, we're the least successful among 11 other developed countries, which would include Germany, Netherlands, New Zealand, Norway, the UK. We rank last, and we have, according to Commonwealth Fund, for many, many years. And what's also most troubling is that we spend the most money towards healthcare. However, we have the worst outcomes.
And how would you say that has been affected by the so-called Obamacare reforms? Has it improved things? Is it too early to tell, or what's your take?
When you're taking a systemic approach to policy, we have to be very careful to make assertions of the success or failure of a policy too quickly. What we have found is that with the implementation of the Affordable Care Act, that we have certainly covered more individuals, whether that is through our marketplaces where individuals will buy personally their own policies, or have been covered by governmental funded medical systems such as Medicaid. So from that standpoint, we have more people who have health insurance. What is yet to be seen is whether the healthcare system is at a place where it can adequately serve the individuals with this additional health care, whether the system is healthy enough to build an infrastructure where individuals are going to be able to access all of the health care that they need for very complex medical issues. And so what I will say is that in the short term, I think that it's promising. In the long term, it's yet to be seen, but there are several of us from public health who understand that Obamacare is not perfect, though policies are never perfect. What we hope is that 5 years, 10 years from now, that the United States will not be at the last place in comparison to other developed countries as far as quality of care and effectiveness of that care. We do hope that we will be able to go up a few notches in the future.
Of course, other systems are as well not perfect by far, and improvement is always needed. I think in Germany we're doing comparatively all right, although I don't have any rankings in front of me right now. But there are always things to improve, and reforms are always necessary. And there's no such thing as a finite point of any policy development. And that's exactly because the systems we live in are constantly evolving. So we need to constantly reapply the policies.
Yes, and I'm hoping with imputing this whole idea of being comfortable with systems and evolution of social organization and social systems, that we tend to have a benchmark in our minds when we develop a policy. Many of those benchmarks, particularly from public health, would be epidemiological data. We have rates, prevalences, and incidences, which are essentially just measures of how sick individuals are, or how many people are succumbing to particular illnesses. And so we may have a goal that we want to reduce preterm births within a particular population by 20% by year X, correct?
Yep.
And we need that. We need that kind of framework in order to try to make sense of what do we want the policy to accomplish, eh? But 5 years from now, or by that year X, it's then time to recalibrate, because the system, the healthcare system, the patients, society in general, they've had to live under the policy. And the environment in which the policy was developed initially is different because the policy is now there. And so revisiting that policy in the future is certainly necessary, and I do believe that using a systems approach will help to make sense of that. And not to be afraid of that. I know some of us are really interested in having this whole idea of getting society in balance, having some type of homeostasis or equilibrium. I think the problem with that is that it still makes it, Moritz, you made this point, we have comfort in this finite idea of where we're going, right? But I like to see policy, and I think hopefully you would also agree, and your listeners would agree, is that we are always in a state of striving towards some horizon. And that point that we are going towards will change. And the policy would then change and accommodate for this new understanding of where we want health status or health outcomes to go. So always moving forward and always reassessing. And that is the point of using a systems approach. And your listeners might say, so how is that different than what we're already doing in policy? What my book and what I'm hoping my book will do is bring the elements of general systems theory, which did begin in the natural sciences, and bring a methodology or a kind of scientific framework to our understanding of how a system actually changes. And so that's what I'm trying to do with this book, is make system science accessible to a broader audience. I'm not trying to create system scientists. I don't label myself as a system scientist, though I certainly have to be abreast of that discipline. But I think what's most important is that we shouldn't say that we're using systems thinking. What we want is that system thinking is already going to be at the table. And that every time a policy is written, every time a policy is debated, that it's just going to be inherent to that process that we take into account all of those working parts and how things feed back and affect other unintended or intended consequences of that policy.
Well, there is quite a lot of things, or one I could comment at this point, but maybe as a first thing, you're right. We definitely need a definition of success. We need certain benchmarks that need to be reached in order to reevaluate our approach and how we follow up on the goals that we've set ourselves. It's always a good idea to keep in mind the whole system. And coming back to classical systems theory, like from Bloom and Parsons and others, it's always concerned with understanding how the systems interact both within themselves and with other systems. And in the case of health policy, and then of course both the health system and the policy system interact with each other and with the other systems in the society. And with that in mind, could you maybe tell us what motivated you to write the book? What motivated you to actually sit down, probably in the evening, to just write those pages and write what you had to say?
What drove me to my computer and what drove me to carpal tunnel? I really thought that there's something that I could say that perhaps wasn't necessarily being said. And you mentioned before that I think that I am unique because I have that exposure to the humanistic approach to the way that I think about the world. I also have the exposure to the natural science approach to the world. And I think that that's like policy is where I thought that I could make the best contribution. And that's what I love to talk about. That is what I live and that's what I breathe is policy. And so it probably began, I started off looking in ethics. And if you note that this book was actually a part of a series with Springer in public health ethics. And ethics allows those kind of messy conundrums, grappling with that. And so there is an element in public health and medicine, as I would say the ethics community and even some of the policy community, that is comfortable with the fact that thought experiments or thinking is a great thing before we do. Thinking is good before we act. Because policy making tends to be extraordinarily reactive, meaning that we are reacting to some grave incident, and so we are then trying to recalibrate how we are going to deal with that healthcare crisis. And bringing this whole idea of systems and what your organization is trying to do as far as looking at public policy as well as this continuum and this goal, I thought that this is something that could add to this discussion. It doesn't replace policy analysis. It certainly doesn't replace system scientists and big data, though some could say in my book there is a homage to big data in the discussion of things like game theory and some of the one of the models that I developed. But far more than that, I want individuals to know that you may already be thinking in this way, but often it's difficult to be at that table to bring in fresh approaches when in policy we are afraid to make some changes because there are grave consequences if this policy doesn't work. But far often than not, and we call this policy resistance, we tend to change the same components or elements of a policy. And you say history repeats itself, it's the same thing. If you're changing and hitting the same nail, you're going to splinter that wood in the same way. It's not going to be successful. So bringing systems thinking or system science to the table and hopefully getting more legitimacy in policy, I believe, is where we certainly need to go. And I hope that this book, in a very small way, will help to open up that discussion.
Well, yes, let's certainly hope so. And I think maybe this coming in with new ideas and sets of ideas that are maybe not originally necessarily from the policy level is quite important. And I also think that your motto is very much in line with other new ideas coming into the more established realm, for example, with the economy being affected or hopefully being affected by concepts and ideas surrounding degrowth.
Yes, that's what I love about the policy community, honestly, is that we have this broader vision. We are not afraid to open up our lens. All I am asking with this book and to introduce to the policy community is that there are some of us who really have taken the time, or we enjoy breaking down how we're looking at the different components. And what I also wanted to do with the book as well is I didn't want to concentrate solely on the different components of what would make up the policy itself. I was also interested in this whole idea that the people or the institutions or the societies that have to live under those policies are also complex. And so we have something like a Russian doll nested egg kind of situation where you have networks and systems within systems within systems. And that's really what I wanted to hopefully get across, is that people have to work and live and exist. They make decisions. Those decisions are made within networks and systems, which then will affect how the policies are enacted or how successful they are. And all of those things, and I'm not to scare us in policy, but we are not afraid of the fact that we have a great work to do, and it is not easy work because the job is never done. The job in public health is never done, but certainly the job of policy and governance is never done. But we also have to answer to society. You're saying, well, individuals are still dying at this particular rate to tobacco. So why are these policies not working? Why are individuals in my neighborhood still without access to fresh fruits and vegetables? Why do we not have a supermarket and we have convenience stores in our neighborhood? We still have to answer to our public.
Well, yes, but this also brings in this element of readiness, of the cultural readiness of policies, which I think are somewhat underestimated, which is a somewhat underestimated element where you can be the smartest person around, but when you can't or don't address the problems that are most dire in the community you want to affect, then whatever you're doing will count for comparatively little.
Yes, and as I also mentioned in the book, I certainly think that there are some policies that are more salient to individuals because they have a lived narrative. They feel it is personally affecting them or those that they care about. The other policies are kind of working in the background and they may reap the benefits of them, but it's not something that they're thinking about every day. But for a particular society that needs fresh fruits and vegetables, then yes, this is a policy I want my policymakers to take care of right now. This is important to me right now.
Yes, and that goes back to the idea of going case by case. And that's why I actually think that systems approaches can do a lot of good, especially because they're not dependent on the specific circumstances and can adapt to them rather than being tied to them. And by that, I guess they can actually enrich the process much more than the details.
I love the phrase you just used, enrich the process. Why did I not use that in my book? That's precisely what I hope that systemic thinking will be. And there may be some policymakers to say, or policy researchers say, well, we already think systemically. Yes, you certainly you may be thinking systemically. However, I did want to introduce the world of systems theory and some of the tenets of that world and bring that into the discussion because I do think that there's something that could be learned from systems theory to enhance the process of what policy is already doing.
Yes, and that's really the thing with the systems theory. Yes, it's kind of a big idea. But in the end, it's not about reinventing the whole damn wheel, but trying to make it run more smoothly.
No, we're not reinventing the wheel. We're just trying to certainly make the mechanisms of that bike make a little bit more sense. We just want to add that additional wheel to that unicycle so it's a bicycle. We just want policymakers to understand that we understand how difficult this work is. This is an arduous job to have such responsibility for how others are existing. But I think that that's what's so wonderful about what systems and policy can do. The fact that policy can reach scores of people in such a powerful way. And I think that the whole bringing in of systems theory to help to highlight some of those nuances can only help. It can only enhance the process, as you mentioned before.
As you said, it's an arduous process. It's a long process. And it's partially a brutal process. But in the end, it can actually do some good for other people. And that's what policy is about, right? At least that's what it should be about, helping people to fulfill their potential. And at least for me personally, that's what makes all this trouble we're going through worthwhile.
I would agree. I would certainly agree. If policy is able to bolster an environment where it can be easier for agents or people to make healthy decisions or have structures that they can have access to in order to maintain healthier lives, then policy has done its job. Is giving that opportunity and access. And hopefully the individuals will make that decision to take advantage of them. But policy is a powerful thing, and I hope that all of your listeners who are doing this work realizes how effective policy has been in helping population health. We always have work to do. We're never quite satisfied, but without policy, many of these successes we would not have today. So thank you.
That's exactly the question. What other way is there to improve another person's life other than policy, especially looking from a systematic point of view?
I would agree, and I would say that I think that the future I see a good opportunity for bringing systems thinking into this idea of global and local governance, because you make changes, or you make positive change at that local level. And there are great universities right now that are doing work in that area. Particularly, I'm familiar with work in South Africa where they're looking at this whole idea of health system strengthening.
Okay.
And the work that they're doing in African health systems. I think that can be a really great example of what can be accomplished by bringing systems thinking into systems that are perhaps certainly in need of help. What I'm hoping is, and what I really appreciate by this opportunity, is to say that I am not flippant enough to believe that I am, busting through with this big innovation. I'm only hoping to bridge some thought communities that may not necessarily be at the same table regularly, to know that systems thinkers like myself would love to have more involvement with the governance community and bring our expertise to the table. And at the same time, just know that we're not asking for individuals to wear a T-shirt or a sash that says, "I am a systems thinker." What we're hoping is that, as Donetta Meadows said in Thinking About Systems, is that we want individuals to break through paradigms, to be open. We want minds to be open. And that is what we want in systems, is to break away from convention. And we do understand that there's so much to be gained and so much that could be lost to society with health policies that are not successful. But with each learning point across the horizon of a policy, we just ask that at those points that we look at as many components as possible, because in the system we're never going to be able to harness every single component. But there certainly will be some components that will be quite clear. Let's take that time to see how all of those things are interworking. And one last issue that I'd like to mention is that we tend to talk about side effects of policies, or those are really just unintended consequences. There was something about the development of that policy or the implementation of policy which was imperfect. Perhaps we tried to change an element that was less than optimal. Perhaps there were some reactions by other agents after the policy went into place that affected the effectiveness of that policy. Understand that, as you've already said, and I've said throughout this discussion, is that policy is over the horizon. It is coming. It will morph. It will grow. It will breathe with the very people that it's trying to affect. So come on the systems bandwagon. That's what I could say to all of your listeners.
Yes, very much so. As someone who has, let's say, dabbled in systems theory, it's a very interesting topic, and especially when you're trying to take the whole of the system into consideration.
As much as possible, you're correct, yes. We have to have boundaries on a system for it to be meaningful. That goes without saying.
Well, all that's left to say now, I guess, is thanks. Thank you, Michele, sincerely for talking to us. I think it was a very interesting discussion. I really enjoyed it, and I really hope that our listeners enjoyed it as much as I did.
Thank you for being so gracious to have me on your show today, and I will continue to follow your work. It's a wonderful thing that you're doing. Thank you so much.
Well, we appreciate it. Thank you. Thank you for listening to this episode of the GPPW podcast. If you like this episode, please do recommend us to your friends and colleagues. You can as well find us on Facebook, Twitter, YouTube, LinkedIn, and of course, gppw.org.